We've got an hour to get through a few bits and pieces with regards to iron and celiac disease in women. So just a few housekeeping notes. I put the iron up there. That's no relevance to anything that you should be doing with regards to ironing. So I just wanted to let you know that this is a general webinar. So it's to highlight some key information pertaining to iron and to celiac disease and the combination and the relationship between the two. So all information that was presented in this webinar is correct at the time of creation, and there are some links at the end of the webinar that you can access for some more information. So for individual advice and support, please see your registered professional, your GP, your nurse, or a dietitian within the New Zealand health system. And like I said, this webinar will be recorded and available via Coeliac New Zealand's YouTube channel at a later date, and I can send that link out to registered participants when we've had a wee edit of that one as well. So let's kind of start with what we hope to get through tonight. So what is iron? And I'm sure this is probably something that you have you're au fait with, and you probably have some idea of what I'm talking about and why do we need it, and just reiterating the importance of this particular mineral for women and for people with celiac disease as well. We will discuss the iron deficiency and some of the symptoms and the various stages of iron deficiency, and just have a wee look over what blood work would look like and the results that they will clinically tell your professional. And then we'll delve into a wee bit about the connection with celiac disease and why this condition is often associated with diagnosis for some people for celiac disease. And then I'll run through how much iron do we actually need. And I've got in there RDIs, which is recommended daily intakes, and we'll discuss that a wee bit later on and what that kind of means for everybody at different stages of their life. I'll touch on some food sources of iron, and of course, I'll also touch on supplementation, and then we can kind of wrap that one up there. So what is iron and why does iron matter? Well, we've got in our whole dietary intake, we've got macronutrients. So they're the ones we need in big quantities. So they're our carbohydrates, our protein, and our fat. And then, of course, we've got micronutrients, which are our vitamins and minerals, which we need in smaller amounts, hence the name micro, and that's where iron fits in for us. So iron is an essential component of hemoglobin, so our red blood cells within our body, and that's a protein that transports oxygen from our lungs to all of our tissues. So it's a really important component of being able to transport oxygen from our lungs out into our peripheral. It's also got lots of other important roles. It helps in muscle metabolism. It helps us with physical growth at various stages throughout our life, neurological development, and it's a key synthesis of some of the hormones, and it plays a role in keeping our immune system optimal. So you will see when it comes to some of the signs and symptoms of iron deficiency, the consequence of having low iron in some of those areas. So our body cannot make iron, therefore we need to get it from our diets. And we can find iron naturally occurring in some foods, or over the years it's been fortified into our foods, or it can be found as a supplement. So I just wanted to touch on the 3 stages of iron deficiency. This is just kind of a run over of what you might encompass if you talk to your GP about these sorts of things. And the first stage is low iron stores. So when you go to your GP and you have a blood panel work done, it might show up that you've got low ferritin. So ferritin in the blood panel is indirectly associated with the amount of stores in your body of iron that we have. So often people can have low iron stores, but they'll have no symptoms attached to it. So that's a mild form of you getting low in the iron department. So stage 2, these are progressive kind of stages, is what they technically call iron deficiency. So this is often associated with the commonly known symptoms that you might have heard of. So fatigue, pale skin, brittle nails, brittle hair, those sorts of things. And on your blood work, this will show up as low ferritin or decreased ferritin, and also decreased transferrin saturation. Now, transferrin saturation is a measure of the iron that's bound to the circulating protein to transport it around. So it's calculated as a percentage. So if we're low in ferritin, iron stores, and then we're low in the iron being bound to the protein, we're getting low in iron. And stage 3 is anemia, so iron deficiency anemia. So this means that the body doesn't have enough iron to produce the hemoglobin, which is that protein in the red blood cells. It can often result in shortness of breath, fatigue, cold extremities, and on the blood panel, this will show as low ferritin, low transferrin saturation, and this is when your hemoglobin levels will be low. And often some people get this picked up when they go and give blood, because that's what they're testing in their little pinprick that they do. So just wanted to highlight some of the common signs and symptoms of iron deficiency. So these won't be new to many of you. And like a lot of conditions, they transfer into other conditions too. So it's often hard to tell. So tiredness and fatigue is the big one that we all associate with low iron. Difficulty concentrating or learning, particularly for younger people, this is what they notice as well. And often people can be prone to infections and get every cough and cold that comes around for them. They often have cold extremities, so their fingers and their toes can often feel the cold a lot more. And headaches is another one that people often associate with iron deficiency. Like I mentioned, some people notice that their hair and the nail is quite fragile, so it breaks quite easily. Shortness of breath, particularly for pregnant women, this is one that they notice with a lot of pressure on the abdomen anyway. This is one that comes up quite a bit. And for some people that have angina or chest pain, this can be worsened by having low iron. And then palpitations, which is a racing heart rate. So the next question is why? Why do we have low iron? And I guess there's many causes of low iron, but simply put, you've either got not enough consumption of iron-rich foods in your diet, you've got an increased need for iron, so various stages throughout your life, you've got excess blood loss. This could be through menstruation or it could be through something else, and or you've got poor absorption of iron, and that's where we're going to touch on in a minute. So I'm particularly talking about women because it's Women's Health Week. So who is at risk? So I guess this isn't an extensive list, but women who are menstruating, so from the start of 14, 15, particularly teenagers, women who exercise regularly, they have found that running or runners or endurance runners or anybody that runs really has a higher risk just through the mechanics of the exercise. Those that eat vegetarian or vegan style diets are often at risk of low iron. Pregnant women or breastfeeding women also have lower iron and increased needs as well. And then of course there's those that restrict their diet, those that have erratic eating patterns or yo-yo dieters, all of us women that are busy, that don't get to the table when we should and eat regular meals. And then of course those that have underlying conditions, for example, like we're going to discuss, celiac disease. So I just wanted to highlight, because I work for Celiac New Zealand, the relationship between low iron and celiac disease. And I have had both our members and some clients that have been diagnosed with celiac disease through having low iron as their symptom. So I just wanted to briefly touch on what happens with regards to celiac disease. So particularly talking about undiagnosed celiac disease or untreated celiac disease. And what happens in this is that the villi, which is within the small intestine, the finger-like projections become damaged. And that's from the exposure to gluten and the inflammation that that's caused. So you can see here on the illustration on the left-hand side is what normal villi look like, long finger-like projections. And then on the right, there is somebody that has had celiac disease untreated or undiagnosed for a while. So it's flattened. And so what happens is that iron in its metabolism is absorbed within that small intestine. So that's where all the action happens predominantly for iron. So you can see here through the GI tract that the small intestine is down here, around and up and down, and the villi line the small intestine. So if the villi are damaged and iron is expected to be absorbed through that villi, through the small intestine, then it's going to struggle to do that because of the damage that having untreated celiac disease has caused. So therefore, if the villi look like this, so if they're flattened through that untreated or undiagnosed celiac disease, then iron will struggle to be absorbed as it should. So what can we do about this? And I guess the first thing for people with diagnosed celiac disease is to heal the gut. So follow a strict gluten-free diet as soon as you've received a diagnosis. Give your gut time to heal and repair, and it will take time to heal and repair. And often some people will have need a year, 12 months to 18 months for it to repair. And that depends on when they were diagnosed, how long they may have had it before it was diagnosed, before starting on a gluten-free diet. The other thing that we'll touch on is supplementation, and that's quite a key thing for a lot of people, and that's if it's warranted. So this is really important to discuss with your health professional, whoever's looking after you and your health needs, around what your iron levels are doing in your blood panel and the next steps around supplementation for that. And I will touch on different types of supplementation later on. And so the next thing is to make sure that your GP or your health professional regularly assesses your iron status through blood tests to make sure that it's come up to the reference range, so a good range for your age and stage of life as well. And sometimes, you know, when it is quite low and you have had celiac disease for a while, so it's taking a wee bit, sometimes supplementation is the way to bounce it way up to where it needs to be. As a dietitian, we're always talking about food first, but there is cases in which supplementation is just what's warranted to get those nutritional panels back up to the standard. And then once you've kind of got your iron status up to a reference range that's within the average, it's around maintaining a good intake of iron-rich foods to ensure iron requirements are met from there on in. And like I'll show you in the next slide, these changes through different stages of life as well. So how much do we need? And this is what we call a recommended daily intake reference table. And the information has come from our New Zealand Eating and Activity Guidelines and the Australian Iron Foundation as well. So the recommended daily intake has been analysed and calculated at a population health level. So this means that this is the amount that's needed for 97 to 98% of the population in order to function at an appropriate level. So if we look here, we can see that on the left-hand side, we've got what we call RDIs, and it's iron is measured in milligrams in this instant, and the left-hand side is for males and the right-hand side is for females. And down the middle, we've just got varying ages of life. So I wanted to highlight a few. So when we're young and when our children are growing up, they need between 9 and 10. So male and female, toddlers and young people need about the same amount per day. And then you will notice, particularly the females, they shoot up. So from about 14 to around 50, we need quite a significant increase in our iron intake per day. So around the menstruation starting, females need about 15, and then it ups to 18 as we go through teenage years to adulthood as well. And then down the bottom, you can see epic numbers are needed for when we are pregnant. So 27 milligrams is the recommended daily intake for females during pregnancy, not due to the loss of blood because they're usually not menstruating, but due to the increased needs that they need in order to carry on a healthy pregnancy. So let's just kind of touch on iron in the diet. As I said before, we can only get iron from our diet. So, I'll just go back there, sorry. So there's two forms of dietary iron. So there's heme iron. This form of iron is found only in animal products. So red meat, the redder the meat, the more iron, poultry, seafood, those sorts of things. Heme iron is more bioavailable, which means it's more readily absorbed in the body than the other form of iron. So if we can, these are the best iron choices to make is our heme iron foods. For vegetarians and vegans, this is often where the struggle comes in because it's only found in animal products. So here's just some iron sources for heme. So we're looking at red meat. So red meat has got, around 2 to 3 milligrams of iron content. Then we've got sardines is up there as well. Fish has got some. It's not particularly high because it's a white meat. The same with pork. A really high iron content is animal liver. So any liver that you consume is, of course, exceedingly high in iron, which also has to be monitored to make sure that people don't have excess of that. Not that there's many people that I've met in my consultation that regularly have liver on their dinner plate, but people do have it. And so the other form of iron within our diet is what we call non-heme, so heme and non-heme. And this form of iron is predominantly found in plant-based foods and iron-fortified foods within our supermarket. So things like legumes, lentils, leafy greens, iron-fortified cereals. There have been some breads, not so much gluten-free breads, but they've been fortified with iron as well. It is less bioavailable than heme iron, and it is impacted by components in other foods, so what we call inhibitors, whereas the heme form of iron isn't so inhibited by these factors. So here's some non-heme iron sources and their iron content. So you can see gluten-free Weet Bix up there has got 1.2. We've got eggs up there. We've got brown lentils too. So lentils and legumes and those sorts of things are actually a good source of non-heme iron. So they're a really good opportunity for vegetarians or vegans or just non-meat eating people to choose as part of their dietary intake. Spinach has always had a reputation for being high in iron, and I think there was at one stage an infographic that showed how much iron you actually had to consume in order to get the same as, for example, red meat, and it was quite excessively large amount of spinach, but it does contain some. So it's really important to kind of weigh everything up in the scheme of a meal as opposed to an individual component. So I just highlighted a little bit about inhibitors, what we call iron inhibitors. So there are components within foods that can either help or hinder the absorption of iron in those iron foods that we're eating. So polyphenols, phytates, oxalic acid, and calcium, these have been suggested to inhibit the iron absorption, particularly our non-heme sources. So things such as your tea, your coffee, red wine, some legumes and cereals. Phytates are found in legumes as well as like cola drinks, and some leafy vegetables like spinach and silver beet have also got oxalic acid within them too. And calcium supplements and products are also suggested to inhibit iron absorption. And I guess, you know, people hear that, and then particularly some of my clients that I've had that are vegan then get a bit concerned because that is the predominant protein within their meal. And I think it's around being really practical about these inhibitors and enhancers. So we still have to consume these foods because they're really good for us. Some of these, the legumes and the spinach and the silver beet. So it's really about what practical steps can you do in your day-to-day life. And one of the really easy ones that is suggested is to take away particularly your tea, your coffee, or your red wine if you're that way inclined, and have it at another time separate to your iron-rich meal. So just have it, you know, after dinner, have your cup of tea or coffee, you know, an hour and a half afterwards. Ensure that if you're on calcium supplements, that you take them at least 2 hours before or after meals is really just a really good indication to kind of eliminate that risk of it inhibiting any iron absorption. And for many of you, you'll probably already know that vitamin C is a known enhancer for absorption. So you'll notice if you've been on iron supplements in the past that many of them either contain vitamin C or they're prescribed with vitamin C for this very reason. And of course, you can also help by enhancing your meals with particularly citrus-based fruit and some vegetables, and get vitamin C enhanced meals with your iron-rich meals. So I just want to reiterate about, you know, whilst we say these are possibly inhibitors, we still have to be able to eat a well-balanced diet. So just making sure that you take that practically and do what you can. So tea and coffee and red wine are the real obvious ones that we know we can separate from our meals if at all possible. So I did just want to touch on supplements. So iron supplements are available on prescription by your GP, your nurse practitioner, or your dietitian, or at the chemist without a prescription. So you can buy them over the counter at your convenience as well. And there are a wide variety of forms of iron supplementation within the scope of the chemist. And sometimes it can get overwhelmingly difficult to know, you know, what you need, how much you need, what you should be looking for, and to get rid of all the marketing hoopla and just get what you need. And so in the first instance, I think it's really important that if you are prescribed an iron supplement, then you take what is prescribed for you. If you are taking an over-the-counter one, that you have that discussion with your pharmacist. They're very knowledgeable in this area. What you're looking for when you're looking at supplementation is the amount of elemental iron, which is the actual iron in the formula that you're consuming. And some of the liquids that are on the market have very little of this elemental iron in them. Therefore, they're actually unlikely to treat a deficit. So it's just to kind of be consumer aware of those sorts of things, and to ask the pharmacist and talk to the pharmacist around that. Talk to your health professional about what your needs are, what your blood work is doing, what your requirements for your stage of life are doing. And the other thing, whether anybody's had one before, is there's a criteria to be met, but iron infusions are also available for people that have got extremely low iron deficiency anemia, and these are usually done within a hospital setting. And so that might be something that your GP has suggested for you, and I'm sure they can help you through that one. And so I just wanted to highlight a couple of really key resources and information that I don't know why it keeps flicking on me, that I stick up with my clients. So Beef and Lamb sponsor Iron Week, but ironweek.co.nz have really good resources available on their website, as well as recipes around beef and lamb, of course. If you take that aside, they actually have some really good, safe, general guidelines around different iron foods and iron needs of different cohorts in society. Healthify, which is the old Health Navigator site, is awash with information. And, you know, if you are on iron supplements and you're struggling at the moment, because iron supplements have always been known as poo pills, because the symptoms that a lot of people get when they take iron supplements soon puts them off, because they're often constipated, which is not a nice way to spend your time, particularly when you're already probably suffering with other kind of gut issues in that space. But there's some suggestions on Healthify about how and when to take iron supplements. This is around timing in your meals. You can also, and this is a discussion to have with your health professional, you can also, whilst it's been prescribed one a day, you can also try one every other day, those sorts of things. See what kind of works for you if it helps improve your symptoms of taking the iron supplements. Also, just wanted to put a bit of a highlight on our website at the moment, celiac.org.nz. I know a few of you have come through as members to this webinar, but there's also, it's gone out to a network as well. So there might be people that are not aware of Celiac New Zealand and our membership kind of based organisation. And, you know, have a look at the website, have a look at the membership. If there's somebody that you think would benefit from that, then sign them up. You can always contact us for any more information or questions in that space as well. For those of you that are members, I'm hoping that you've already touched on the YouTube channel, which we're hoping to add more and more to videos, because I think that's a really good forum for people to get information and knowledge. We've got videos around cross-contamination in the kitchen. We've got top tips for newly diagnosed. We've got our medical advisory panel talking a lot about varying research that's going on as well. So I encourage you all to have a look at the YouTube channel, and you're more than welcome to kind of flick us some ideas on what you think will be useful discussions or talks or presenters to have on that space to talk about health concerns that you have with regards to celiac disease. I just wanted to, this was just a bit of a short rundown on iron and celiac disease, and I wanted to thank you for your attendance tonight.